physician, Dr. Teitelbaum, author of the new book, Healing the Thyroid with, am I saying it right? Ayurveda? Ayurveda. Joins us this morning to talk about the un-American way she helps her patients. She relies on a 5,000-year-old system of traditional healing from India known as Ayurveda. Yep. So she shares her methods in her latest book, and she joins us this morning with some of her research and her practice. First of all, thank you so much for joining us this morning.
Thanks for having me.
Why do we look to India instead of the advances of modern medicine here in the States?
Well, there's basically two types of thyroid patients you'll see. And the first type are people who have full-blown thyroid symptoms: weight gain, depression, constipation, fatigue. They might grow fibroids. And yet when they get their blood work drawn, it shows the thyroid looks normal. So they're told nothing's wrong with them, and they leave the office feeling frustrated and hopeless. Now, there's a second group who do have problems that show up on blood work, and yet when they take the thyroid hormone, they still have the same symptoms. And in either case, when they decide to seek out alternative medicine, we're a fairly new country. We don't even have an established tradition of holistic medicine. We don't even know most of our herbs yet. So India has the most ancient 5,000-year-old tradition of holistic medicine. So it's good to turn our sights towards what they're doing and take some notes in their system.
So herbs are the basis of your treatment instead of medication, vitamins, supplements. Why is that working?
It works because not just that the herbs are special and pharmaceuticals aren't. They don't have side effects and toxicity like pharmaceuticals do. But in the Ayurvedic tradition, we're taught to get to the root of the problem. So, for example, if we see someone does have a thyroid problem, we want to see the various reasons, which are a little different in each person, why they have that problem, fix the problem, and then we could support the thyroid gland using different herbs like this.
Now, in my family, we talk a lot about this. I think I shared this with you. My brother was diagnosed with hyperthyroidism 10 years ago. He tells me now, he wished he knew some of the methods that you use, because for him, it was either get it removed or do the radioactive treatment. Are those the only two options people traditionally get when they walk into a doctor's office?
Yes, and that's why I wrote the book. What they should have done is to see, why was his thyroid hyper? What was torturing the thyroid to make it produce so many hormones like that? And fix that thing so that the thyroid doesn't do that anymore. It's all common sense.
Let's talk about the diagnosis. You're not doing traditional blood tests. In fact, Dr. Teitelbaum and I just sat here. You can just feel a person's pulse and kind of know what happens. Tell me, you felt mine, and I don't mind sharing because you talked about it with me. What did you figure out from my pulse reading?
You're the reason I wrote this book. You're the typical patient that I see thousands of in the course of 1 year, where you're probably getting blood work done and they say your thyroid's fine. But in the pulse, you can detect very early stages of imbalances, we call them, that if we don't address them now, will blossom into a bigger disease and maybe show up on blood work later on down the road. So it's easier to fix these imbalances now before they become so big. So in your case, you're showing where the thyroid's weak. And when the thyroid's weak, the gallbladder automatically becomes weak. The gallbladder has a lot of functions. I have a whole chapter on the gallbladder in my book. But one of the primary functions is that it gets rid of estrogen every day. Estrogen makes things grow. It makes the breasts grow, the hips grow, the endometrium lining grow, but we don't want too much growth. So our body's very wise to get rid of it. The liver dumps it in the bile, comes out every day in the bile. But if the thyroid's not working, which yours isn't, the gallbladder won't empty the bile, the estrogen reabsorbs, and then you can grow different things like cysts, fibroids, like she did.
It's incredible. Now, if you don't buy into it, because some people don't, they just like to go to the doctor, get medication, and go home. Tell people how long before they can come see you. If I go on the website today to make an appointment with you, how busy are you?
2 to 3 months you'll have to wait, because people love what we do. We're having phenomenal results. And people are tired of just suppressing symptoms of disease. And that's exactly what we do with the thyroid. If your thyroid's weak and you take a thyroid hormone, all it's doing, it's only serving to throw the thyroid into hibernation, because it realizes it doesn't need to make the hormone anymore. That's not the art of practicing medicine.
You have to fix the root.
You want to fix the root, yeah.